Welcome to Population Health Plugin, a podcast highlighting current public health issues in our community and topics of interest to students across the university. I'm your host. My name is Sebastian, and I'm here with Jonathan, Jerry, and Serena. I'll let them introduce themselves.
Hey y'all, my name is Jonathan Baker. I am an undergraduate public health major with a minor in international studies.
Hey everyone, my name is Jerry Spillers. I'm a graduate in public health major concentrating in healthcare organization and policy.
Hey everyone, I'm Serena Springer. I'm a junior here at UAB. I'm majoring in public health and minoring in entrepreneurship.
And for those of y'all that missed it, I'm Sebastian again, and my major is immunology, and I'm getting my master's in public health in epidemiology concentration. To start off this podcast, we kind of just want to give y'all an insight on where we came from and why we're doing public health, because I think every public health student has like a very unique story. So, Jonathan, you said you're minoring in international studies.
Yes.
I think that's really interesting. Like, why are you doing that?
Okay, so as we all know, or most of us know who are public health majors, is that global health is a very important topic and that cultural identities are very, very important to understand when we are addressing health issues. So I originally did not enter with the public health degree, as many people do in this field. We came in from other STEM majors. So I originally walked on campus at UAB as a biology major, faced the pandemic in Bio 1, and ended up in Dr. Rout's class. Faced the chem plants, which are like
Tough
pineapple.
class.
Yeah, tough class. Very much a weed out class. Faced the chem plants, which are like pineapples and like how they respirate. And I was like, I hate this. So I changed major public health right as the pandemic started. So that's like the shortened version of how I ended up here. But yeah, I had taken a few classes in public health as a minor before I came into this major. So yeah.
You liking it?
If I didn't like it, I wouldn't be doing it. I think that's like the best
I think
answer.
that's true for all of us. What about you, Serena? I heard you're doing entrepreneurship, and I know you told me before this podcast you had a little bit of a journey to public health. So what's your story
Yes.
like?
So I had quite the journey. I was originally a bio major too, and I wanted to go to med school. And then I've always been minoring in entrepreneurship just because I've always had the dream of starting my own business in dermatology. And once COVID hit, I felt kind of really lost and didn't really know what I wanted anymore. So a friend of mine switched his major to public health and was telling me all about it. And of course, I didn't really know what it was at first, which I've learned a lot of people kind of relate to, not knowing what public health is. And so he told me like how the professors were really easy to grow relationships with and the smaller classes and kind of just like what the courses were like, which I was fascinated with. So I switched to public health, and I love like how it focuses on promoting health for all. And it's something I've always wanted to get involved in and learn more about. So yeah, that's kind of my story. And the goal is to still go to PA school now, but I love public health and am enjoying the major a lot.
Interesting. So what's the entrepreneurship side like? How does that tie into public health? I'm like really interested by that because I haven't heard of anybody else doing like public health and like business or anything like that.
Yeah, so I feel like a lot of people will minor in business, but the entrepreneurship major was really new, and I think it started my freshman year. So I kind of just liked how, because I've always just wanted to start my own business, and entrepreneurship is, you're your own boss and learning how to start a business and all. So that's kind of why I did it. It doesn't really tie into public health as much. I mean, it could, since I want to start my own business in the healthcare field, but yeah, that's kind of why I did it.
I love that. That's really cool actually. I think everybody wants to start their own business and be rich too.
Yes, I recommend it.
Jerry, what about you? I know you're doing public policy. What's that like, and what got you into it?
Yeah, so I can go back to the undergraduate for me. When I was a freshman, I came into UAB with, I guess, like everybody's hopes of being a doctor or some type of nurse or something like that. But math and science was not my strong suit, apparently. So then I picked up the major healthcare management, and I think I took a class with Dr. Chambers. Love her to death. Amazing professor. And she put me on with minoring in public health, and that's how I got my undergraduate degree in healthcare management with a minor in public health. And so then I figured I might as well, when I got to the graduating point, I was like, well, what am I going to do? I know I probably don't feel like going into the working field just yet, and I know I don't want to take a huge gap year. So I went and decided to continue on school and get my master's in public health, and that's where I'm at now. And so the policy piece was with my degree in healthcare management, I want to become a health administrator and also have high hopes of going to law school after I get done with my master's degree. And so I figured, okay, policy work and law school would be a good hand in hand combination, especially if somebody like me wants to go into litigation and medical malpractice and represent underserved and low income families within the medical industry, within the healthcare administration industry. I thought that would be a perfect, trait for me to go down. And so far, I've loved it. Everything I've been doing has been fun. School has been enjoyable, meeting a lot of new people, doing a lot of new things, such as being on a podcast. So here we are.
Dude, that is really cool. I think what's interesting is like how we can tie in public health in so many different ways. I mean, Jonathan's international studies, Serena's entrepreneurship, Jerry's doing public policy with eventually going to be a lawyer in litigation. At least for me, I know a lot of y'all might laugh at me, but I am that pre-med. I'm technically an undergraduate student. I'm majoring in immunology, trying to be a doctor. So I'll be applying this upcoming cycle. But for me, what got me into public health is, I mean, growing up, I lived in Zambia for most of my childhood. It's a country in like sub-Saharan Africa. And when I went there, I had been moving around a lot as a kid. I was born in Chicago, grew up in Peru a little bit, then went to Zambia. So a lot of movement. But in Zambia, I remember one day we went to go visit with my aunt this orphanage for kids with HIV. And I think I saw a nun there who was she was like a nun / had some kind of a medical practice. So medical nun, I think is the right term. And when I went there, I was like, wow, this is like interesting. Like this nun dedicates her life taking care of these people, like, and takes in more and focus on building a community of kids who are orphans and they have HIV. They have nowhere else to go, and she takes care of them. And when I moved back here to the States, I saw the way things are here. And I mean, not to say that the U.S. healthcare system is perfect, but I mean, you just don't see like people like with HIV not having access to care.
Yeah.
So that was like, wow. I mean, I definitely want to do public health just because I feel like maybe with just an MD, you won't be able to reach as many people as maybe with a public health degree. And that's why I'm doing epidemiology, really, because epidemiology is all about, there's a lot of data, which is hard, but it's all about trying to reach and make an effect on a great number of people. And the same, in a different way that policy is, because policy is so interesting because you can enact real change with that, like practical things. Epidemiology kind of feeds policy, and that's what I like about public health and what I'm doing.
Yeah, Jonathan, I just want to say, like, epidemiology and policy, like you said, go hand in hand.
Yeah.
And that story you shared makes me think of, another reason why I got into public health was because being African American and somebody that has and still does struggle with mental health, it's a hard conversation to have. And being in public health gives me the tools to, like, advocate for people who struggle with anxiety and depression. And it's definitely prominent within the Black Belt, which is a passionate area that I work in all the time. And so hearing stories like what you just shared, it's definitely everywhere. And people in public health have the tools and the capacity to make definitely huge change.
Dude, that's an awesome story. You're right, Jerry. I totally agree. And I think it's like very cool that you also have like a personal motivation to practice policy and do well, because I think that always drives people further. I think we have a really diverse group of people, and I know we want to spill the beans on something that's very important to us, and I hope will be fun for the whole School of Public Health. And that's going to be National Public Health Week. That's coming up really soon. It's
2 weeks.
It's 2 weeks, right?
2 weeks, 3
Jonathan, you
weeks.
know the exact dates?
It is the first week of April.
Okay, first week of April.
To
So
be specific, April 4th through the 8th.
thank you,
Yes.
Serena. So
Literally.
I don't know if anybody knows out in the public, but we are actually it's a collaboration between honestly the entire School of Public Health. I mean, PHSA, USGA. We have deans, faculty working on things, alumni, but we're going to be hosting like a week-long event for National Public Health Week. And so just to give a really broad overview of what we're going to be doing, it's going to be fun, first of all. But what we want to do is make it as engaging for our public health students as possible. So we will be running a Blazer Kitchen Hygiene Drive competition all week. So this competition is going to be between graduate students, undergraduate students, faculty, and staff. And we're going to have 4 boxes in the lobby. And just as long as you donate as much hygiene, toiletry, supplies as possible, your group will win the competition. I want to see who's the most charitable out of all the bodies, don't y'all?
Yeah, and engaged too, truly.
So, and then Monday we'll be doing a merch day. So if you come to the School of Public Health building, we'll just be giving as much merch away. So make sure you show up, because if you come late or if you don't show up late, you're not going to get any merch. And it'll be t-shirts. There might be water bottles.
There's stickers. Honestly, anything imaginable.
Yeah.
Come get your free merch.
So you guys want to show up. Tuesday, we'll be having Birmingham AIDS Outreach testing bus on the green. It'll be a good experience. We're still ironing out the details of that, but it'll be good for people to come and get engaged with Birmingham AIDS Outreach. They do awesome work with the HIV positive community of Birmingham. And we'll also be having simultaneously a public health tabling event. Just come, talk about public health, and have any discussion on what it is. We'll have students, maybe possibly faculty, and we'll just be hanging on the green. And make sure you tune in for the State of County Address that Tuesday. We'll give out times on all these events later on as we finish ironing out, but that will be both virtual and in person. So make sure you tune in. It'll be really interesting updates on the State of the County Address. Wednesday might be the most exciting event of the week, actually. We'll be doing a scavenger hunt. So this is an alumni event, so make sure you show up to meet some alumni. They're really cool. I've actually had the chance to meet some of them through the Alumni Advisory Board. And there's some really cool people working in Alabama that are a part of the Alumni Advisory Board. So I'm not going to say anything because I want y'all to come and find out for yourselves. But that'll be all day from 9 to 3. There'll be alumni tabling at the School of Public Health building, and they'll be running a scavenger hunt, finding items around campus nearby, and hopefully y'all get the chance to meet them too. And then in the afternoon, we'll be having a hoot, which is yet to be ironed out. It'll just be like a fun little Kahoot, and the State of Public Health practice will be broadcasted on Zoom virtually, and hopefully y'all will tune in for that. Then on Thursday, we have a luncheon with the dean in the Hill Student Center. We'll be having free food, so show up. It's on Engage, so sign up if you haven't already. And you'll be able to meet the Dean of Public Health, Dr. Paul Irwin, and you'll also be able to meet a bunch of cool faculty we'll have over there too. Then we'll be having another merch day that day, so get your free shirts, free water bottles again. We're giving you all 2 chances, so there's no way you miss out. And later that night, we'll be having a Pathways Percentage night at a location to be decided. Friday in the morning, we'll be tallying up the Blazer Kitchen Drive, and we'll be doing that live in person, so make sure y'all show up to get the in-person tally. Make sure nobody's cheating or miscounting the numbers, and make sure you get your final items in. And then we'll also be handing over the items to Blazer Kitchen. Yes. So if anybody wants to come help, because we need a little bit of help with loading and unloading, probably they've told me, that'd be awesome. And we'll also be giving away free insomnia cookies to celebrate the end of National Public Health Week. Jonathan, Jerry, Serena, is there anything y'all want to add?
Yeah, I kind of wanted to add, I think overall we just want this event to be as engaging and fun as possible. I think that's what brought all of us at least together. You know, Jonathan and I are senators for USGA, and then Jerry and Sebastian, vice president, president of PHSA. So we've just realized there's a big gap and disconnection with public health, and we really just want this event to be as engaging and fun for not just public health students, but even people like me who struggle to figure out what major they wanted to be or what they wanted to do. So I think it'll be really fun, and it's something everyone should come to.
Yeah, to piggyback off of that, I'm excited. I hope you guys are fired up. It's been, 2 years since we have done something on campus, and I've seen some people in person. So I think it's going to be a great event for the whole public health and even the school to come out to and be involved with it. So I'm excited to see new faces, familiar faces, and just make new friends.
So to wrap it up, I think we have a fun week ahead of us. I don't know about y'all, but I'm excited, and I hope y'all are excited. It'll be an awesome week. Thank y'all for listening.
Yes, thank you for listening.